Thank you all for being here, and we're just kind of going to discuss some of the figures and some of the things that have been going on, and talk about all the variants that really have been around the country. So, well, today we're very pleased to announce that through the partnership of the county, UMC, and the city, we're actually at 68% of everyone 12 years and older have been fully vaccinated. And that's a comparison with the state of Texas of 43%. 79%, which is an incredible number because we don't have a large fallout. We do have a certain percentage of people that don't come back and get their second vaccine, but we're at 79% of first vaccine, which is 12 years and over, which the state of Texas is at 50%. Our hospitalization rate is 3.29, and currently we have 606 cases active right now, which is really a low cases as we talk about. 65 and over, which was really one of the largest things that we focused on, the county judge and I, when I first took office, was 65 and over, and how do we make sure that we get them vaccinated, and how do we make sure the most vulnerable of our population continues to get vaccinated. Fully vaccinated, which is an incredible number, is 86.6%. And partially vaccinated, it's 95%, which is, you know, our goal was, of course, our herd immunity is to reach 75%. And we're really getting really close to it. Between July 7th and July 14th, we've received 251 new cases of positive COVID-19. Now, we have been doing tracking because it's really important that we track those and find out where they're coming from, who's getting it, and how we can continue to effectively know what's going on. So 251 cases, 76% of those were unvaccinated, and that's a huge number. 31% due to travel. So we identified that people are traveling that are not vaccinated are coming back and they become positive. 10% of those have required hospitalization. So that's a number that we'll continue to track. Now, we've been talking about the differences in the variants and what's going on, and whether we have an open facility for testing. Well, the county, the city was really using the DME's medical examiner's facility while we were testing. We were using kind of a common area. Now, with the CARE money, the city bought a building which is right across the street from the 911 center on Railroad Drive, and we're converting that into the testing center. So we figured while the cases were down, we were able to move our equipment and be able to open up. Now, we'll be opened up and operating by the first week of August. And all we're waiting for now is to make sure that we get all the proper certifications, and quite a few certifications that need to happen when you do have a testing facility. One thing, and people have been asking about the Delta variant, are we testing for it? Well, you don't test any differently. We test the same way. And the state and the federal government actually randomly takes samples from us and asks us for samples, and it's the same sample that we gather, and that's how we determine where the variant will be. Right now, because we're reopening our facility in the Northeast area, we send ours to Lubbock, and then Lubbock kind of drills down on it, and then they go and get the genetics, and then that's how it's determined. It's taking about 7 to 10 days to see what type of variant it may be. Once we open our facility here in El Paso, and like I said, we closed it down to move it because we felt that the number in cases were low enough that we could open it up and use the facilities we had purchased. Now, that will take between 3 to 4 days. And so we're looking at in the first part of August. Now, when someone becomes COVID positive, whether it's Delta variant or any of the other ones, it is important that the treatment is the same. There is not a different treatment. So when you become COVID positive, the quarantine and the treatment is no different regardless of which variant you may have. Now, we do know that Delta variant may be a little bit more contagious, or quite a bit more contagious, and that's why it's good reasoning to make sure that we know what we have. So it's really been a great partnership with the county and all our providers to make sure that we get our community vaccinated. And you see the numbers speak for themselves, that we're at 79% first vaccine, which is 50% from the state, and we're almost at 80%, and we're almost at 70% fully vaccinated. And not one person, not one entity could have done it without uniting our voice. And I'm very proud that the county judge and I were able to really unite our communities and speak with one voice. And I think everyone today here sees the results of what's going on. Judge, thank you again for your partnership.
Mayor, thank you, and thank you for your partnership. You know, we learned quite a few lessons, and one of them that I encourage the media to be as accurate as possible. We learned that any miscommunication from the media really takes us down the wrong path. We're going to try our best to get, you know, we know how to do this. I think as a community, we went from some of the worst conditions in the country to being able to challenge and be where the mayor has given us some incredible numbers. But to know that 76% of the positive cases are unvaccinated, that's a very powerful message. We also know that sometimes they'll tell us that some of the young adults are not listening, don't hear the news, but we do know that they do listen to their grandparents and their parents. And so we're going to talk a little bit about, you know, what do we do now? You know, how do we move forward? And we know that's going to be a very important. We know how to test for the Delta. I mean, that's very important that we know that. We have all the confidence. The mayor works very close with his team, and we know that we know how to adjust and recognize what it is. We continue to be cautious. We know that being prudent has always been a great way to approach our community. If you remember at the beginning, the mandates were lifted, but our community decided to say this is what we have to do. So the mayor and I are really here asking you once again to really look at what happens and then address it properly. We also know that El Paso historically from the beginning of the pandemic is about a 30-day delay. So what happens around the country, what happens in Texas, eventually we're going to be addressing it. So there's nothing more important than being able to prevent what's going on. We want to send a strong message. The mayor and I are convinced that we have to open the economy, and while we open the economy, we have to be cautious by wearing the mask, getting vaccinated. But one of the things that's important is that we open the bridges and that they're open as soon as possible. And that'll happen more likely if we do the right things and they see that we're able to address them. One of the things that we've been doing is a binational approach at Tornillo, as all of you know, has been very effective, and we're now at 24,000, and we're able to do the 50,000. We have to reemphasize that we have non-COVID capacity at the hospital, so any spike, and that's information that I think you need to take to heart to know that things are different. When we had a spike before, we were at 50% hospital capacity, so it took a long time to get there. If we had a spike now because of the non-COVID delayed treatment, we could get to that spike pretty quick. One of the things that we know, and then the mayor and I know that we got to get from the 65% herd immunity, we got to get to that 75, but we now have, people are being hesitant. We have an agreement with the Paso del Norte Foundation and behavioral health scientists at UTEP, and we're trying to figure out that number of people that are hesitant, not try to guess at it, but try to figure out exactly why are people being hesitant, what's happening, because that's something that we have to do. It's a great study. The mayor and I will be sharing that information to find out creative ways to get from 65 to that goal of 75. This agreement, like I said, will provide us with the right strategy so that we'll be able to understand what we need to do, and we need to make it a little bit more tailored. So once again, we have to be prudent. We know how to do this. Our community knows how to do this. We know how to prevent situations. We've been very excellent at doing that. I'm hoping that the collaboration between the mayor and myself and everyone else here in our community will keep us from going in the wrong direction. So concerned, we had 300 plus positives today. So we're going in the direction that we don't like to go. And so once again, we thank you for being here. Be prudent. Get that mask near you. If you're in a situation that you don't understand, then wear the mask. As simple as that. We've got the flu season coming up, and we expect one of the highest flu seasons that we'll have in a long time. And the only prevention for that, as you well know, we only had 55 cases of the flu during pandemic, which was a typical average was about 850. So this is one of the best weapons. It's the treatment of choice is the vaccine and the masks. So thank you very much.
Thank you, Judge. And I think one of the things that's really important to say that today we have no Delta variant cases reported in El Paso. And have we been testing for it? Yes, you test the same way you would test for COVID-19. And we have been sending out, because they become randomly samples, that how every city, every state, everyone's doing it the same way, to the state and the federal government. And as soon as we open up our center, which is just waiting for final certification, but it's nothing new. It's not we're getting a new center and we're getting something different. It was just that we had bought these facilities and we were sharing it with the medical examiner, and now we've moved all our equipment over and we're just waiting for the final certification. So yes, we are testing, and we have no active cases today of Delta. With that, we'll open it up to questions.
Hi, Judge Fernandez. We can go to some questions. My first one is, what are some of these creative ways to get people on vaccine? Will there be incentives left? More incentives like how Mexico have the max to max slaughter?
But what we're looking at, the mayor are looking at creative ways, but we also know that one of the, some of the things we've read already from the study is that trusting voices is very powerful, that we get individuals like the mayor, that, people trust him, hopefully myself, and people begin to go out there and talk about it as much as we can. We've got to get, it's interesting that young adults got sort of a little bit of the older generation, a little bit of a problem during the pandemic. But now the grandparents could play an amazing role because they listen to them to say, you know what, I don't want this to happen again. So, is that like in the Oscars where they cut you off?
I think it's important to see that, the county judge said we were one of the worst in the country. I'm going to clarify that. We were the worst in the country. So what more incentive can you imagine than being one of the worst cities in the country that was COVID positive and the many of lives that we lost? So, and you can see that our community has responded. When you're at 79% of the people of El Paso have already had their first vaccine, that's a huge number. And 68%, a little over 68%, almost 70% have had fully vaccinated. So now you look at the 251 new cases that we were able to report last week, 76% of those were people that were not vaccinated. That's a great incentive. So we hope, and we cannot emphasize the importance of being vaccinated. And I think these numbers really show why it's important.
Yes, can you talk a little bit about how long it takes and how often samples are sent to be tested out in Lubbock, from when they go to how long it takes for that to be processed to find out what the variants are? And does the rise in cases recently change any timelines for the county reopening and the city reopening?
Yeah, we're open. We didn't close. So it's not reopening. We just moved our process center, but we're still, doing the COVID testing. We're still sending it. But right now, when it does go to Lubbock to have for whatever variant to look at genetics, that takes right now between 7 to 10 days to return. Once we open up the facility here in El Paso, it'll take 3 to 4 days. You're still going to have to send out because genetics is a specialty type of testing that really nobody really has except the government in some special areas. So that's where it goes. Now, the COVID tests, we get them back in a day. We'll still be able to do that. We'll continue to do that.
Yes, Mayor. How many breakthrough cases do we have so far in El Paso?
I'm sorry, I didn't hear. How many what?
Breakthrough cases.
Breakthrough cases. What do you mean by that?
Yeah.
Explain that.
Yes, the COVID-19 breakthrough cases. So like after being vaccinated, like you still get.
So you have.
It's a very minimal amount, and I don't have the number for you, but I can tell you that it's a very, very minimal amount. As you can see by the percentage of the unvaccinated cases was 76% of the 251.
And I can get you, if you follow up with me, I can get you the specific number.
This was going to be for Dr. O, but I see he's not here, so hopefully you guys are still able to answer this. The American Association of Pediatricians' recommendation is that children under the age of 12 stick to wearing a face mask in school, obviously, since they can't be vaccinated themselves. Do you agree with it, and should the governor allow school districts to implement their own mask mandates?
Well, as you saw the release today by the Pediatric Association saying that anybody over 2 years of age and going to school, they will recommend. They think it's really, really important for kids to go back to school. And so they agree that schools need to open and kids need to go back. But they also said that kids should be wearing the face mask. As you can see, I wear my face mask at all times because we can never be too cautious. And so I agree that we should continue to wear face masks. We should understand and know our surroundings. And that's the important part. Understand and know your surroundings. Because I can tell you that by looking at me, looking at the county judge, you can't tell whether I was vaccinated or not. So you need to take the precautions and make sure you protect yourself and your family and your coworkers. And that's the important part. Should you still social distance when possible? Absolutely. Should you sanitize your hands? Absolutely. As you know, as things continue to, the cases start spiking again, I think it makes it more important that we continue to protect ourselves, but our loved ones at the same time.
You know, we talked about, we don't understand things. What's the best thing? You wear your mask and then you figure things out instead of don't wear your mask and see what happens. So we know it's very preventive. We've seen it with the flu, as I said earlier. It's incredible what the mask will do. And as we're learning things, then we're able to understand what we need to do. But always, err on the side of caution, and I think we're going to be much better off.
I mean, are you asking if there's any guarantees? You know what? There is no guarantees in anything we do today. But I can tell you that we need to make sure that we do this, what's the best for ourselves, our friends, and our relatives. And I think that's really important. So can I guarantee anything for you? No, but I can tell you that science and the numbers that we talk about kind of show statistics. Yes, sir.
En realidad no hay un número, no es como llegamos a tal lugar, son muchos factores. Los factores de cómo está Juárez, nuestra capacidad de vacunar. Creo que lo que estamos haciendo en Tornillo es muy importante porque mandamos un mensaje, el alcalde y su servidor, que sí podemos con la situación. El miedo que yo pienso que fuera es de que se abren los puentes y no sabemos manejar el número de gente que no está vacunada. Ahorita sabemos lo que ha hecho la ciudad, nosotros sabemos cómo. Hemos llegado hasta 4,500 vacunas en menos de 4 horas. Es un mensaje muy importante, porque si ellos creen que no podemos manejar la cantidad de gentes que vienen para el paso, vamos a tener, van a estar muy renuentes de querer abrir. Seguimos mandando el mensaje, sí podemos vacunar, sabemos manejar nuestros problemas y todos están haciendo un esfuerzo. Juárez está haciendo un esfuerzo increíble. Lo de Tornillo sucedió en gran parte por la logística de ellos y la capacidad de nosotros. Y esa combinación hizo el trato binacional que tenemos en este momento.
Hi, I know you don't have the exact number yet on those breakthrough cases, but does the city and county have a way to determine which one of those cases, which vaccine they had, and how many of those were either fully vaccinated or not?
Well, I think the fact that the statistics are really good. So if you had COVID, it would have been reported. So if you were to get COVID again, then you would have record that they've had COVID. So I think we're pretty good at the data now, and we feel very comfortable that if we're going to give you statistics, and as Estrella said, we'll give you accurate numbers. But I feel very confident that the city is able to gather that information and do the best we can with that information that we receive.
And again, and I know I've said this more than once, but of the 251 cases reported the week of July 7th through July 14th, 76% of those were non-vaccinated, and a lot of them, and 31% of those had traveled outside the city of El Paso.
Yes, hi, this is for you, County Judge. I learned this morning that at Toledo, there were so far 23,000 Maquiladora workers vaccinated. And I know you wanted to get as many of those Maquiladora workers vaccinated before Wednesday, the July 21st. How are we gonna get to that goal of reaching 50,000 vaccinated? How specifically?
Our agreement is that we do by August the 2nd, 50,000, independent of the bridges opening or not. You know, we've always looked at it, if you notice, what helps us tremendously is that we always look at the glass half full, not half empty. If they open it on the 21st, we continue as much as we can. The mayor will set up hubs so that we can take people that are crossing. If it closes, then it gives us one more opportunity. We already talked to Director Mancha to give us more opportunity that if it's closed, we're able to continue and even do more. In our meeting with County Judge Cortez, we shared our best practices. They're asking for 80,000, even independent of whether the bridge is open or not. So they're looking at 80,000. So every time we've upped it, we're capable of doing quite a bit depending on the situation.
By mentioning Judge Cortez in Hidalgo County?
Hidalgo County,
Okay.
that's correct.
All right, yeah, I was gonna ask the latest on expanding.
Yeah, they started this week, very excited, and I think we're helping each other. We're a border community, and we're gonna help other border cities as much as we can. So very, very fortunate that we have an ongoing relationship prior to this.
And just to be clear, you said that you would want to reach that goal of 50,000 vaccinated Maquiladora workers by August 2nd. There's still going to be at the port of entry?
Yes, yeah, that's it. The project is Maquila because they have great logistics with their manufacturing facilities. And the agreement is 50,000 by August 2nd, so we still have time to get there. We didn't know if we could get the vaccines. We got confirmed that we'll get about 52,000, so we'll be able to reach that goal.
Yeah, as cases continue to go up across the state, we're getting a kind of a clear picture as to who's vaccinated and who's not, since most of the people getting sick are the ones that are unvaccinated. Locally here in El Paso, you mentioned 76% of these infections were of unvaccinated people. Do we have a breakdown of their ages? Are these young people that are refusing the vaccine, or are these some older people that are not getting the vaccine? Do we have a breakdown of whether there's a majority of people here in a specific age group that are getting infected with COVID-19?
Well, I can tell you that 65 and over is 94.7% of those have had their first vaccine, and 86.6% are fully vaccinated. So we know that it's not 65 and over because of the vaccination rate that we were able to achieve with that. Now, do we have an exact age breakout? We don't, but we're looking at it, like I said, because it's really important that we track and continue to track where it came from and how we continue to control it, because as you can see, a lot of cities are starting to take precautions now, and some of the cities have gone to level 3 now, and they've gone to a stricter protocol because of COVID, and we don't want to get there. We want to talk to our community, make sure that they have the facts, and that we continue to do the right thing. So, going backwards for us is not what we want to do. We want to continue to excel and go forward, and based on the number of people that we've had fully vaccinated, I think that we'll be able to do that if we just get that final push to get our citizens vaccinated.
Well, one of the exciting stats that we're going to get from the Paso del Norte Foundation and UTEP is we'll be able to identify the areas of people less vaccinated, and we'll be able to reach out to them. So we'll know the hot spots of unvaccinated. So.
What are you doing back there, Judge?
They keep cutting me off.
One more question. All right, well, I thank you all for taking your time, and it's so important that we meet with the media and we talk about the facts. And again, the facts are we have no Delta variant in El Paso today, and the testing is no different than before, and the treatment is the same whether you have any type of variant or just a regular COVID-19.